Welcome. You've been issued a new chemical irritant spray called REPULS. As security professionals, it's important for you to know some information, knowledge, and training about your new product, REPULS. On the canister, you'll see that under REPULS, it says 180 inverted technology. What that means is that you can spray the product, the canister, at all angles, and we'll demonstrate that a little bit later. Underneath REPULS, it shows that there's no contamination and easy mitigation. We'll explain and demonstrate it a little bit more further down in the demonstration here. The ingredients, ammonium propionate. Underneath there's some information about storage. Proper storage. You want to make sure that it's not under heat or flames, or that you don't store it above 120 degrees because the canister could burst. As you scroll further down, there's some easy first aid information. We talked about easy mitigation. Simply flush the eyes with water, and we'll explain that a little bit further. On the back side of the label, there's some information regarding expiration and the serial number. The solution is good for up to 5 years shelf life. REPULS is not a tear gas, it's not an OC spray. It's a chemical irritant, it's water-based. 70% of the solution is water-based. When I spray it and do it during the demonstration, you'll notice that the stream is very precise and there's a lot of water that comes out. And you'll notice that on the mannequin when we demonstrate that. Part of issuance of your new canister is once a month, please inspect your canister. What you're looking for is any dents, puncture, leaks to the canister. In addition to that, you want to make sure you properly are holding it. You want to hold the canister in your fist, not in your hand, by your fingers holding it in your hand like this. You're going to use your thumb to lift up the flip top and make sure that that is working properly and flips down on its own. In addition to that, while you're inspecting your canister, make sure you're looking for any dust, dirt, or debris in the nozzle area or under the flip. If you notice that there is a lot of dust and dirt, simply clean that with a Q-tip. What we're going to do now is I'm going to demonstrate the proper use of deployment and where we're going to deploy REPULS. For deployment of REPULS, what we're going to do is we're going to deploy on the forehead, temple area, right here. Especially if the individual is wearing glasses, we want to make sure that we're right above the glasses in the forehead area. What this will do and allow is for the water, as I mentioned before, REPULS is 70% water. The water, gravity, it will flow down and into the eyes. One of the things that we are not recommending is that you directly, at close range, deploy REPULS into someone's eyes. However, we're looking at aiming in the forehead area, temple. So at times, you may need to adjust depending on your environment and the situation. As you're holding your MK3 canister in your hand, you have it in your fist, and we're aiming towards that forehead. We're giving verbal commands to the individual. As I'm moving in, 3-second burst, follow your proper policy and procedures with taking the individual under control. And once that individual is under control, then we will communicate with that person and provide some help and assistance. You notice that the solution has a blue dye to it. So it's important so that you are aware of that. Also, one of the things, the considerations is that make sure that if you do deploy, that they're not in an elevated position. The individual is not on a stairwell and has the potential to fall. As I mentioned before earlier, because their eyes involuntarily close. And once they close, you're responsible for that individual. So we need to offer that person some help. Once they've calmed down, we are able to then tell them that, hey, I can provide some help and assistance for you. We'll get you, we'll mitigate this, and I'm going to explain how we're going to do that right now. Okay, one of the things I'd like to point out too is that if you notice, from the time I sprayed to the time I approached, that I am not affected by the solution. I'm able to talk, I'm able to breathe. The person that's been sprayed too, the individual that's been sprayed, has no difficulty breathing. Again, the irritant's getting into the eyes. There may be some irritated skin, but they're not going to not be able to breathe. If I were to spray some type of pepper spray or OC, I would not be able to stand here and have a conversation. I would also be affected by it. So simply for mitigation, we talked about earlier, is flushing the eyes. Our recommendation is a 12-ounce bottle of water and a towel. What I'm going to do now is, quite simply, I would just tilt this person's head to the side and I would flush their eyes with the bottle of water, just like this. And then after I do that, I would take the towel and wipe their eyes and face. After about 2 to 3 ounces of water, the individual is quickly going to tell you that they feel better. Our recommendation is you use the entire bottle. So I'm going to continue flushing the eyes. And the purpose for using the whole bottle of water is that we want to make sure that all the irritant is out of the eyes. Once you've done that, their symptoms will not persist and they have fully recovered. Okay, now with REPULS, I'm going to demonstrate using the 180 inverted technology. So again, holding the canister in your fist, using your thumb to lift up the flip top. The individual is now coming towards me, and I'm moving where I'm standing from. I now move my fist to the side, and the canister is at an angle, and I need to move quickly. And as I'm moving, I'm now going to deploy this REPULS spray onto the individual. The 3-second burst, as I'm doing that, I'm now on the move coming towards that individual. I take that individual under control, and I'm able to not be affected by the solution. I would not be able to do that with OC or pepper spray. I would not be able to get in this quickly. I would not even be able to take this person under control without being affected. So I'm able to breathe, communicate with that individual. That individual is able to breathe and communicate back with me. I'm able to explain to them how to calm them down, and then I'm here to help them by simply, again, using a bottle of water and a towel. I'm flushing the eyes. REPULS is truly a unique product. It's going to allow you to do your job safer, quicker, and more effectively. It's going to give you the confidence again to use a chemical irritant spray. Personally, I'd like to thank you for the sacrifices you make day in, day out, for the job that you do. And I'd like to welcome you to the REPULS team. Thank you.